of applause, ladies and gentlemen. Thank you, sir. You can stay. I think ma'am and Dr. Satike and Davison sir can stay on the stage for the questions. I think there are some questions on that's already posted, so I will read them.
There's also a very large team of cardiologists who support Dr. Satike. Of course, they are busy at the hospital, but we would also like to place on record the tremendous work and support of the cardiology team.
So the first question, on this, I think we'll finish this, says please explain again how robotic surgery is beneficial than open surgeries. 2, robotic surgery is future of heart surgeries. Please explain the cost again, thanks. This is from Rohit Shishodia, Drug Today Medical Times.
Procedure.
So Rohit, this is for you and for everybody else as well. The way robotic surgery is done is to the right or the left side of the chest, depending upon which part of the heart you want to access. So with robotic surgery, we make small holes which are 8 millimeters in size. Technically we call them ports. And through these small ports, those robotic arms, if somebody is there from Da Vinci, Pankaj, for somebody, can you just take out those instruments? They can actually see them. That's okay, fine, thank you. So basically, these are robotic instruments. These are the robotic arms, this is the instrument. And these instruments are 8 millimeters in width or diameter. So these goes to the chest exactly like you see here. They go to the chest wall and inside, these are the same kind of instruments we use in open surgery, the tips of these. So with these we do the surgery inside. And when you go through these ports, we don't cut any bone. So damage to tissue, damage to the chest wall, and damage to bone are all avoided. So when you do surgery like this, patients, it's very, very common sense. Basically, patients heal very fast. There's simply no chance that they get infected, and because the damage is so little, there's no blood loss as well. We could actually do that,
Yeah, why don't we do that so you understand that the surgeon is sitting at the console and enabling this movement. So this is the power. And then you may wonder, why can't he do it directly? The access that this machine has is far deeper than if you do it externally. So the first step was actually minimally invasive surgery, where they did it without the robot. And now with the robot, this is enhanced access, enhanced precision.
You can see that, if you look with your naked eyes, you actually cannot see this RBI there on that 10 rupee note. Yeah. So when you look at this, you can, Pankaj, can you zoom that again? If you look with your naked eyes, you actually cannot see the RBI there. So the robot gives you that level of magnification or resolution. Look at that. This is something you cannot see with your naked eyes.
So it's a combination of precision, access. The robotic arm is steady always. So it's precision, access, magnification, and therefore greater outcome.
So actually not done of a surgical team, entire team in the operative field. That's why it's more precise.
What you must also understand is this, that the surgeon is actually sitting at this console. The console is about 3 feet away from the patient. The machine sits next to the patient. And next to the machine, you're going to have a surgeon who also sits and aids in the surgery. It's a surgeon or a surgical assistant who sits there and helps in the surgery. So it's actually 2 people who are working together. That's why I said it's never one man's achievement. It's a team achievement here. You have 2 surgeons and surgical helps who come together to do this operation.
And all of you can visualize that if you can be sitting 3 feet away, you can be sitting 3,000 miles away. So one day, surgeons from India will operate on patients across the world. That is the power of this technology and the capability of the Indian surgeons.
You can see how he is operating the arm.
And you may be wondering, this is the trainer. This is the robotic trainer. So the simulators where, because this is a very new skill to learn. And therefore, Dr. Sathiki has not only learned it, perfected it, using it, but he's also training other surgeons so that many more centers can do what he's doing.
Yeah, ma'am. Right.
Dr. Anish?
Sorry.
Action. Thank you.
Thank you. Dr. Sathaki, the next question I think was if you can generalize the profile, age, comorbidities of the patients who are fit for these kind of surgeries.
That's fantastic. I think it's very relevant. Robotics as of now is not ready to perform on small children. So we cannot do robotic surgery on children below the age of 16 years. So somebody needs to be of a good height and size for these long robotic arms to be able to go inside and operate. Otherwise, practically all adult patients are suitable for robotic heart surgery. In general, we don't want to do very, very complicated patients with multiple problems. So we want to do robotic surgery in people who require both a bypass as well as a valve replacement. They are not candidates. So if it's a one single procedure, even if it's a complicated single procedure, it can be done with a robot. I hope that answers. So for those patients in whom we cannot do robotic surgery, we choose minimally invasive surgery. So I think if you look at 100 patients who come for heart surgery, practically 80% of patients will either fit into robotic surgery or to minimally invasive surgery. And only 20% of patients are not suitable for both and will have to undergo open surgery. So 80% don't require open surgery as of today.
So somebody wanted to know if this is the future of the heart surgeries.
This is absolutely the future of heart surgery. I told Madam also that 10 years down the line, if you're sitting and talking about heart surgery, we're not going to be talking about open surgery anymore. Robotic heart surgery is going to be the future across the globe for heart surgery. I don't think any one of us wants open surgery. Nobody wants, whether you're young, whether you're old, nobody wants open surgery, and it has to go.
Right. So those were the questions I had on the virtual side. So we are ready to take, I think, questions from anybody who's here. Please identify yourself and then.
One center. This is in the Bangalore Center.
Bangalore, Banagata.
Together, actually, basically, robotic heart surgery being done in two centers in Apollo Bangalore and Apollo Chennai, and together we are about 170 procedures. I did answer this once again. We don't want to operate on children with a robot. Children are not suitable for robotic surgery. It's only for adults and generally over the age of 16 years. It can go on. Our oldest patient is 86 now.
So your answer is there is no upper limit.
It's only the lower limit that you have to think about. Every heart surgery does carry a risk factor. So the risk factor that you would apply in open surgery would in general be the same in robotic surgery. But since those complications are eliminated, I would think that the risks of robotic surgery would be lesser than open surgery. So you're looking at about 0.5 to 1% risk. On an average, yes. It depends on the patient, of course, and his condition. The minimum age, I think the youngest patient we have is in his 30s. I think this man whom you heard, he's our youngest patient. He's just 33 or 34 years old. And the oldest patient is about 84. 84. 84. I didn't get you there. 70 minutes, yes. That's an important benchmark. So if you ask the, yes, that's a very, very good question, and it's very scientific as well. If you ask the robotic industry, they tell you that when you cross the 70-minute mark, you've already reached, a level of skill. Skill in robotics is measured in time. The faster you can do it, the more skilled you are. And 70 minutes is a benchmark for somebody moving to a higher level of skill. Cost of the procedure? Okay. Compared to open heart surgery. So, madam actually mentioned this. I'll repeat it again. Open heart surgery somewhere costs between 3 lakhs to 4 lakhs for somebody who's paying out of pocket or by insurance. And when you bring in minimally invasive into the picture, it adds about a lakh more. Somewhere between 4.5 lakhs, around 4.5 lakhs. And when you bring a robot into the picture, it adds another lakh. Because this machine costs about 22 crores to buy. And then there are a lot of disposables. Those arms are all disposables. So you can use it in 10 patients and you have to throw it. Each one of them costs 2.5 lakhs. Yes, it does cover under insurance.
Most insurances cover it entirely, some cover it partially.
Is there special challenges about that?
These special challenges, yes, like I said, the team. I think the reason that most hospitals haven't been able to do is building a team. Every member of the team for robotic heart surgery is important. They need to be skilled, they need to be able to anticipate what the surgeon is doing. Because the surgeon is sitting here, the patient is going to be there. And the team which is sitting next to the patient should be able to anticipate what the surgeon is going to do next and accordingly prepare. So that skill comes with somebody who's been doing this for a long time. For us, our experience with minimally invasive surgery, 12 years. This is probably very, very large in India. That's what has helped us reach here. Oh yes. Oh, all right. Yeah, this is contactless. So basically you're not coming into contact with the patient at all. For the patient it's definitely good. Good for the surgeons also. But to be honest with you, during the pandemic time we were not able to do many. In fact, this low number is because 100 is still a small number if you ask me as a surgeon. And this is because...
I think we would have reached this milestone about 12 months earlier, if not for COVID. So overall, I think, patients not coming into the hospital, the fear of various things, like the lady also mentioned that during COVID she didn't want to come. So only emergency surgeries really came. So I think that was one of the biggest risks. Biggest problems, but the other big one was that the entire healthcare system was very much focused on COVID, and therefore the amount of other support, there was literally no communication, all other support, outpatient departments were running at a very low key. It was either COVID or it was emergency. That was the service we were doing. So I think there was a huge disruption during COVID, but thankfully things have started picking up over the last few months.
Again, interesting question. There are about 75 installations across the country, robots.
Country.
In whole of India. And basically only 2 centers doing robotic heart surgery. And to this amount, this volume is only in 1 center.
And that's why I said in the very beginning that all of you can be very proud that Bangalore is taking this super leadership position in robotic heart surgery, which is the future of heart surgery. Okay, I think that's it. Thank you all very much. Great pleasure seeing all of you, and thank you. Stay safe, take care. And once again, a great thank you for all the support you've given us over the years. Namaste.